Did you know that medications you take regularly might be jeopardizing your kidney health? Stay with us till the end of this video, as this critical information could be the key to protecting your kidneys and maintaining overall wellness. Our journey today uncovers the hidden threats within common medications and offers actionable ways to safeguard your precious kidneys. In today's world, medications play a crucial role in managing health conditions, yet they can also act as silent killers, especially for the kidneys. As we age, our kidneys naturally lose some efficiency. Coupled with the increased intake of medications to manage various health issues, the risk of kidney damage escalates. Understanding the risks associated with certain drugs can empower you to make informed decisions about your health care. Our kidneys play a crucial role in maintaining our overall health and well-being. These vital organs filter waste products, excess fluids, and other substances from our blood to create urine. When our kidneys are not functioning properly, it can lead to a variety of health problems and complications. One of the major reasons why it is essential to maintain good kidney health is because kidney disease often has few symptoms until it has progressed to a more advanced stage. This is why regular checkups and monitoring of kidney function are crucial, especially for individuals with risk factors such as diabetes, high blood pressure, or a family history of kidney disease. Faulty kidneys can significantly impact the body's ability to regulate blood pressure, produce red blood cells, and keep bones healthy. As kidney function declines, waste products and toxins can build up in the body, leading to symptoms such as fatigue, swelling in the legs, and changes in urine output. Chronic kidney disease, if left untreated, can progress to end-stage renal disease, ESRD, where the kidneys lose their ability to function adequately. At this stage, patients may require dialysis or a kidney transplant to stay alive. Before we dive in, kindly note that all information you'll find in this video is produced by humans and for humans. We do not use artificial intelligence writing tools like ChatGPT to automatically generate content. Let's get started. Number 1. Antibiotics. Antibiotics, essential for combating bacterial infections, can be nephrotoxic, meaning they can harm your kidneys. Some commonly prescribed antibiotics like polymyxins and aminoglycosides can damage kidney cell membranes and accumulate in kidney cells, causing cell death. According to the CDC, nearly 1/3 of antibiotic prescriptions are unnecessary, which increases the risk of side effects, including kidney damage. However, here are practical tips to follow with antibiotics. Always verify the necessity of antibiotics with your doctor. Follow the prescribed dosage strictly. Never use leftover antibiotics or share them with others. Stay hydrated. Drinking plenty of water can help prevent kidney damage by flushing out the antibiotics from your system and reducing their concentration in the kidneys. Avoid alcohol. Alcohol can interfere with the effectiveness of antibiotics and worsen their side effects, including kidney damage. It is best to abstain from alcohol while taking antibiotics. Number 2. Non-steroidal anti-inflammatory drugs, NSAIDs. NSAIDs such as ibuprofen, aspirin, and naproxen are widely used to relieve pain and reduce inflammation. These drugs, while beneficial, can reduce blood flow to the kidneys, causing acute kidney injury, AKI. Long-term use can lead to chronic kidney disease, CKD. Studies suggest that NSAID use can increase the risk of AKI by 26%, particularly within the first 30 days of use. Here are what to do with non-steroidal anti-inflammatory drugs, NSAIDs. Use the lowest effective dose for the shortest duration possible. Monitor blood pressure and kidney function regularly if using NSAIDs long-term. Number 3. Diuretics. Diuretics, also known as water pills, help you move extra fluid and salt out of your body. They make you pee more frequently, which is why many people like to take them every morning. Some people take diuretics once or twice a day at the same time each day. It is medically proven that diuretics help manage conditions like hypertension and fluid retention. While they aid in expelling excess salt and water, as mentioned earlier, excessive use or high doses can lead to dehydration and electrolyte imbalance, risking kidney damage. Research indicates that diuretics can cause AKI, especially in patients with pre-existing conditions like CKD. They work by affecting different parts of the kidneys to alter the process of urine formation. There are various classes of diuretics, each acting on different parts of the renal tubule, with specific mechanisms of action. Thiazide diuretics. Thiazides inhibit the sodium chloride symporter in the distal, convoluted tubule of the nephron. By blocking this transporter, thiazides reduce the reabsorption of sodium and chloride ions, leading to increased excretion of water and electrolytes. Loop diuretics. Loop diuretics act on the thick ascending limb of the loop of Henle by inhibiting the sodium-potassium chloride symporter. This inhibition prevents the reabsorption of sodium and chloride ions, causing a significant diuretic effect. Potassium-sparing diuretics. Potassium-sparing diuretics exert their effects on the collecting ducts and distal convoluted tubules. They either block the aldosterone receptor, such as spironolactone, or directly inhibit sodium channels, such as amiloride and triamterene, leading to a decrease in potassium excretion. Osmotic diuretics. Osmotic diuretics like mannitol work by increasing the osmolarity of the filtrate in the proximal tubule and loop of Henle, inhibiting water reabsorption and promoting diuresis. The overall effect of diuretics is to increase urine output and decrease extracellular fluid volume, making them valuable in treating conditions like hypertension, heart failure, and edema. It is important to note that diuretics can also lead to electrolyte imbalances, especially with prolonged or excessive use. So monitoring electrolyte levels is crucial during diuretic therapy. But we have some practical tips approach that you can follow to use them. Stay well hydrated. Regularly monitor electrolytes and kidney function. Number 4, proton pump inhibitors, PPIs. PPIs, effective for treating acid reflux and GERD, can cause kidney inflammation and damage over long-term use. Studies have shown that long-term use of PPIs may increase the risk of certain kidney issues, including acute kidney injury, chronic kidney disease, and even kidney failure. The exact mechanism behind this link is not fully understood, but it is believed that PPIs may affect the kidneys by causing inflammation, reducing blood flow to the kidneys, or interfering with the normal balance of electrolytes. It is important for individuals who are taking PPIs to be aware of the potential risks and to use these medications cautiously. If you are prescribed a PPI, consider discussing the duration of treatment with your healthcare provider. Short-term use of PPIs is generally considered safe, but long-term or unnecessary use should be avoided if possible. Monitoring kidney function through regular checkups and blood tests can also help detect any early signs of kidney-related complications. As with any medication, it is essential to weigh the benefits against the potential risks and to make informed decisions in consultation with a healthcare professional. Practical tips and safe way of using them. Use PPIs for the shortest time necessary. Have regular checkups to monitor kidney function and magnesium levels. Number 5. ACE inhibitors. ACE inhibitors are commonly prescribed to manage hypertension and protect kidney function. However, combining them with NSAIDs or diuretics and inadequate hydration can increase AKI risk. eGFR reductions due to ACE inhibitors are usually not harmful but need monitoring. It's important to be cautious, especially when combined with other medications that can affect kidney function. Drugs like nonsteroidal anti-inflammatory drugs, NSAIDs or diuretics, when taken with ACE inhibitors, can sometimes lead to a decline in kidney function. Therefore, healthcare providers need to monitor kidney function closely when these medications are used together. Following the practical tips such as consulting your doctor about mitigating AKI risks, maintain adequate hydration. Number 6, antiviral drugs. Antivirals are essential for treating infections like HIV, hepatitis, and COVID-19. However, drugs like remdesivir can lead to kidney toxicity in patients with pre-existing kidney issues. Some antiviral drugs can cause direct kidney cell death or form crystals that block kidney tubules. Antiviral resistance occurs when viruses mutate and become less responsive to the effects of antiviral drugs. This can lead to treatment failure and prolonged illness, posing a threat to kidney health in cases of viral infections affecting the kidneys. Always take the best practical tips such as dosage adjustment. It is important to adjust the dosage of antiviral drugs based on kidney function. Impaired kidney function can affect the metabolism and excretion of drugs, leading to a higher risk of toxicity. Healthcare providers should carefully assess kidney function before prescribing antiviral drugs and adjust the dosage accordingly. Monitoring kidney function. Regular monitoring of kidney function through blood tests and urine analysis is essential for patients taking antiviral medications. Early detection of any decline in kidney function can help prevent potential kidney damage. Hydration. Adequate hydration is crucial to maintain kidney health while taking antiviral drugs. Drinking plenty of water can help flush out the medications from the kidneys and reduce the risk of toxicity. Take antivirals under close medical supervision and never skip doses to avoid antiviral resistance. Number 7. Lithium. Lithium, crucial for managing mood disorders, can cause significant kidney issues such as nephrogenic diabetes insipidus and CKD. Signs of lithium-induced kidney damage include excessive thirst and urination, and in severe cases can progress to end-stage renal disease, ESRD. Practical tips to follow. Regularly monitor kidney function and maintain adequate salt and fluid intake. Adjust dosages carefully under medical supervision. However, if you suspect your medications might be affecting your kidney health, it's crucial to recognize the signs and seek medical advice promptly. Symptoms of kidney failure may include decreased urine output, leg swelling, shortness of breath, and severe fatigue. Understanding these symptoms early can prevent life-threatening consequences. Don't forget to always take the proactive measures such as the following. Regular monitoring. Keep track of kidney function with tests for blood creatinine levels, glomerular filtration rate, GFR, and urine tests for protein. Proper hydration, adequate water intake helps kidneys filter out sodium, urea, and toxins, lessening the impact of nephrotoxic drugs. Healthcare consultation. Discuss all your current medications with healthcare providers to avoid harmful interactions and ensure safe treatment options. Healthy lifestyle. Adopt a balanced diet with lean proteins, fruits, and vegetables, and engage in regular physical activity to minimize the need for nephrotoxic medications. Medications are essential for managing various medical conditions, yet they pose significant risks to kidney health. Being informed and cautious about drug use is vital, especially for those with pre-existing kidney conditions. By understanding the risks and taking proactive steps, you can minimize potential harm to your kidneys. Remember to work closely with your healthcare provider to select safe treatments, adjust dosages as necessary, and monitor your kidney function regularly. If you're serious about mastering your kidney health and understanding how your body works, make sure to subscribe to our YouTube channel, Fit Life Hub. Hit the bell icon so you never miss a vital, life-saving video. Stay informed and stay healthy.